Yeah, check it. Hey, Mr. Sickle Cell, I can see that pain is hell. The way your cells turn to sickles like a witch cast a spell. Hey, Mr. Sickle Cell, I'm hoping that all is well. It's a superpower how your hands really start to swell. You could just punch away your demons, send them screaming into hell. You in pain and the people around you really can't compel. Hey, Mr. Sickle Cell, what? Check it. Hey, Mr. Sickle Cell, yeah, check it. Whoa. Wake up in the morning in pain. Clinic never really open and it's driving you insane.
Hey, I'm Jake Butler. Welcome to the Patience in Progress show, where in life it's important to have patience, but also make progress. I'm excited today because this is the first episode of my show. We're going to talk about real estate, investing, entrepreneurship, business. But today, the topic of discussion is sickle cell anemia. I have sickle cell anemia. Most people don't know when they see me, but I have sickle cell. I've been diagnosed since I was 2 years old, and the discussion on sickle cell was very prevalent in the community. Have some of my friends here in the sickle cell community. We're going to talk about sickle cell. What are some things you can do maybe to feel better? What is some of the treatment in the hospital, how doctors are treating us, how other patients are treating us? Relationships with sickle cell anemia is highly important, so we're going to jump into it. And the cure that just came out for sickle cell, would you take it? Maybe not, maybe so. I'm Jake Butler, and we're going to talk about it. Former school teacher turned full-time real estate investor. How did I do it? We're going to discuss that here on the Patience in Progress show. So let me introduce my guest. French, introduce yourself.
Yes, thank you. Good afternoon. My name is Howard French. I'm an accountant. I'm living with sickle cell disease, genotype SS.
Hello, how is everyone doing today? My name is Josiah Frierson. I am a pastor, the senior pastor of Agape Ring Ministries. I am a sickle cell patient, 38 years old, living with sickle cell SC.
Okay, now, most people don't know, Josiah, but what is sickle cell? Tell us today.
Okay, well, sickle cell is, first of all, you inherit some genes from of course we know we get our genes from our parents, but with sickle cell, we have some abnormal genes. And with those abnormal genes, what happens is, if you get two abnormal genes, you get the disease. With sickle cell, your red blood cells, they carry oxygen to the body. There's a thing called a protein called hemoglobin. And with the hemoglobin, what happens is if your hemoglobin isn't pulling in the oxygen the way it's supposed to, it causes those sickle cells that's supposed to be a circular shape to turn to a crescent moon or a banana shape. And when that happens, they can get stuck in the blood vessels. They can cause excruciating pain. They can cause strokes. They don't last as long as they're supposed to, which causes them to not be able to reproduce, which is why it's called sickle cell anemia, because they will burst open all at the same time, causing our blood levels to drop. And that's pretty much sickle cell as a whole.
French, how would you describe it?
Yeah, pretty much similar to what just as I said a moment ago. The thing is that, yes, with sickle cell disease, it's inherited, yes. But also, some people may say, okay, you don't look like you have sickle cell, you know? Should we look a particular way? You see, it affects each individual's body. As our DNA differs, so does the effect that sickle cell has on us individually. So, for example, some people, overall, blanket statement is that, okay, the cold weather isn't the best place for us. So too is the warm weather. So we're going to try to find some place between hot and cold, in between, where we will be able to live as close a normal life as is possible. And another thing with sickle cell is that we should always be, as much as possible, be hydrated. Drink a lot of water, drink fruit juice and all that stuff. But water. As the old saying say, water is our best friend. And it means, for example, now it's like 92, 93 outside. We are in Miami, by the way. So, you know, I have my water, Jake has his water, and Josiah has his water. So we're all drinking to ensure that, hey, you know, keep themselves alive, keep them alive. Another thing with sickle cell, people who are not affected by our medical condition, their blood cell lasts approximately 120 days, which is like 4 months. Ours last somewhere between 10 to 15 days. It therefore means that our blood cells break down and pretty much they die in quotation 8 to 12 times faster than other people. So that's also another disadvantage, if we may say. Right. And it's a time bomb as well, in the sense that we may be, pretty much okay, everything is all right. Next thing, either of us could be in the hospital in the next hour, half an hour, anytime, you know. It strikes any time, come without warning, but, you know, we have to live the life. Thank you.
Well, for me, to piggyback off of what they said, basically it's a circle blood cell that's a circle, and then a half moon shape is how the cell turns into what they call a sickle. So all of us experience the same thing, and pain is the most not exciting, but the most detrimental thing that occurs to it. We have a new guest that just joined us. So, Maya, we're talking about what is sickle cell and explaining it to the people before we get into different topics on sickle cell. So tell us how you would explain sickle cell.
Well, good afternoon, gentlemen. How are you all today? I'm
Good,
sorry for
good.
returning this, but I got this at the last minute. So
No problem.
I'm just happy to be here. I would describe sickle cell as a genetic blood disorder. You have to have two parents that both have the trait, and there's a 1 in 4 chance, 25% chance with each birth, that you will have a child that has sickle cell disease. So it is a cellular structure that lacks oxygen, and it creates a sickled shape because it is malformed or misshapen. And some of those cells that are destroyed also have waste matter, which can cause iron overload and other conditions of organ failure. So it is something that is the oldest genetic blood disorder known in the Americas. And it impacts those in the Mediterranean, in the Caribbean, Arabia, as well as African Americans and those of African descent.
Yeah, I met someone that was of Spanish descent, and they told me they had sickle cell, and I
Yes.
was surprised that there was someone from the Spanish descent had sickle cell, because I thought it was mostly among black people that had sickle cell.
In America, yes. However, it is abroad throughout the world, globally. And like I said, in Arabia, the Mediterranean, also India, there's SD instead of just SS, SC. And there's SD, which is an Indian strain of sickle cell. So anybody that had connectivity to the continent of Africa for that genetic disorder predisposition has some form of sickle cell, and there's also one in the Jewish community called thalassemia.
In the Jewish community?
Yes.
Really?
Because they are of African descent. Jews were in the desert.
I believe it's found on every continent.
Correct.
I didn't know
It's found on
that.
every continent. Actually,
probably
me,
not Antarctica, maybe the only one.
Really?
me and Maya just
Antarctica.
went to the convention in Orlando, and there were white people there.
Yes.
Yes, there were white people.
Because of the
It's-
Mediterranean,
the Mediterranean.
and the
Yeah,
Italian.
we're
and
always
Sicilian
told.
bloodline.
Yeah, we're always told black, black, black.
But
It's not. It's on every continent. I've met an Indian lady. When I say Indian, I'm not talking about Native American.
Like Hindu.
I'm talking about like from India, and she has sickle cell. She is. She's not black like us.
They had the trait, or they have the
They have
full
sickle
blown.
cell
disease.
So they go to the hospital, they pay
Yes.
medication, everything?
Yes.
Really?
But
Yes.
only difference is they have a little different stuff. Like I know people with sickle cell Caribbean, they don't really get sick. So they
Dietary.
Yeah, for whatever they do, they don't really get sick. So they have a little difference in their. It may be something a little different as far as symptoms and stuff like that, but it's on every continent.
Really?
Yeah,
Absolutely.
it's on every
Did you
continent.
know that?
Yes, I
That's
know
why I
that.
gave you that explanation to indicate to you it's not just those of us in
black-
the black
a black
community
disease
Correct.
or
per se.
of African descent.
Correct.
It transcends all of that.
Correct.
And as you said, just as I said about from the Caribbean, because I'm from the Caribbean, and yeah, we get sick, but it's not as frequently. Sometimes the
frequent, yeah,
hospitalizations, and also, and not to put on the Caribbean, of course, but also in America, you have quote unquote access to medical,
care.
right, to the care. In the Caribbean, sometimes we find our way like home remedy and all of that stuff, to try to cope with the pain.
Yeah.
But
More
there
natural.
because there comes a time when, you just have to take it. But on a sad note, my youngest brother, he and I were the ones with SS. He would have been 55 years old tomorrow, but he died.
Really?
He died 45 years ago.
Oh.
He died on his
So he
10th
was what?
birthday.
He was a teenager?
Teenagers.
Yeah, 10 years old. He died on his 10th birthday.
10.
Wow.
Yeah, he and I were the ones who are SS in our family. He's gone. Our sisters, trait, brothers, trait, needs and everything, trait and all of that stuff there. Yeah, but, he and I were the SS ones.
So speaking of pain, which is the primary thing that happens to us, what are each of you all doing to lessen or try to contribute your pain? I know when I was a school teacher, I would leave school on Friday after teaching all day at the school, check into the hospital, spend the whole weekend in the hospital, get out on Sunday, and then be back teaching on Monday. And my students didn't know that I was in the hospital the whole weekend.
We're able to do that. I don't think it's always recommended, but sometimes you just push through. I've had situations where I had Jill Scott tickets, and I was already in the hospital. The concert was like in 2 days, and I was like, "Listen, you could take the ambulance." I was on Miami Beach. She was performing at the Gleason. I said, "Hey, roll me down the street. I'm going to this concert."
You said take you down the street in a
Yeah,
wheelchair?
yeah, absolutely.
Listen, man.
And my
Say
he
you
was
weren't
like,
missing your concert.
I paid money for these tickets.
Wow.
So the doctor did not do that. I was at Mount Sinai. So I'm like, I'm down the street. You can have the ambulance drop me off and pick me up. I'm going to this concert. She's like,
For
Maya.
real?
She's like, I'm not having it. You're going to get discharged. But I was already in the hospital for like 3 to 5 days. So I'm like, listen, I have other stuff to do. Life goes on. And she discharged me. I was aching and paining the whole way, but I was right up there with Jilly from Philly, and we were doing our thing.
Really?
Absolutely. We've gone on vacations, get out the hospital, next day or 2 days later, get right in the car. You got the pain meds, you got the pillows. We on the road. Let's
gotta
go.
do what you gotta do. That reminds me of a friend
Life
of
goes
mine.
on.
God rest his soul, he passed. But in my younger days, whatever.
Yeah,
before I
younger
became
days.
a pastor, we go to a club and strip club, whatever. We was going that, and he would hear that the fellas are going out, whatever, and he would be in the hospital, and he'd be in the hospital all the time, and he would check out. He'd tell them, say, man, I'm going to get a lap dance.
What?
And he'll check out. He'll go to the club with us, have a good time.
And go back.
And then go right back. Be aching and everything, and he'll go right back. And that's
Because
like Maya said, life goes on. And we can laugh at this now, but it's just like, yes, it's not that we're not in pain, but we also want to enjoy life as well.
Like everybody else.
Like everybody else. So, hey, you got some Jill Scott tickets and you done paid your money. Doggone it, we going to go see
So
Jill
take your
Scott.
water, take your pain medicine before the concert.
Bring it
Hello.
with me. Hey, that's it. You got to do what you got
Woke
to
up
do.
this morning, smile on my face.
Man, I shouldn't say this, but whatever, I don't care. I have left the hospital with my port in my chest. Nurses don't know. And go somewhere. I get my push, right?
Okay.
Call my homeboy.
Josiah,
Call
be careful
Mike.
what you saying.
I trust me. I know exactly what I'm saying. I don't care. I don't do it no more. But I would call my
In
homeboy.
his younger years.
Yeah, my younger years. I would call
Okay.
my homeboy.
Okay.
We would go wherever I maybe needed to go. And then after we go there, do whatever we needed to do, I come right back. I say, listen, I got 2 hours, 3 hours for my next push.
You got a window.
So I got to go do what I got to do. And then, listen, man, let's just keep it real. Memorial check on us like that.
Lord.
But when you go to them urban hospitals,
They get to you when they get
they
to
get
you.
to you when they get to you.
Yeah.
So I had a window that I knew
He was unmonitored.
I was unmonitored. And then as long as Dr. B did not, and he would never put me on it. As long as he didn't put me on that cardiac monitor, I'm good. If he did, I used to date a sickle cell girl. If we was in there together,
put it
and
on
she
her?
didn't have it on there, I put the stings on her and I go do what I gotta do.
You dated a girl with sickle cell?
I dated two with sickle cell.
Why would you do that?
Because they were cute and he liked
They
them.
was fine. They
That's
was
all.
But let me ask you this:
Fine.
so did you ever anticipate the relationship going further than what it was? Because you already know two people with sickle cell, if they get married and have a child, that child is definitely going to have sickle cell. Did you have that in consideration, or you just having
no,
fun?
of course. I was just having fun at the
You
time.
It was a good time, not a long time.
But of course, they knew no kids. They knew that there was no option of kids if we was going to work out. There's a young lady. I don't know if I should say her name or not, but no, it's not in a bad way. There's a young lady. Her parents both have sickle cell. They're both from Jamaica, and like I remember at the convention he spoke how he doesn't get sick like that. So when they had their kids, they was like, oh, we'll be fine. Our kids will be fine because we don't get sick, and they never get sick. But they had both the kids. When the son passed, and the daughter, she's still here. She's still doing good. Young, who I know, and she's older. She's 50, maybe pushing 60. But I'm saying this to say, you have some people that they're okay with having kids like that.
They are.
They are.
Yeah.
I'm
They
not.
are.
I'm not. But there are people who are okay with because they feel like. I remember when in Orlando, the convention, they did like this men's at dark thing where all the men came together and just talk. And they men's, women, kids, whatever. And one of the guys, he was saying, you know, that because of what he goes through, he feels like he'd rather give his children that because he know how to advocate for them and fight for them, and he'll know what they go through. And quite frankly, I was completely against it. I didn't say anything, not to disrespect his wishes, you know, and what he felt. And I think most people in there was against what he said from when we got together and talked. But to him, it was like, it's okay. So I'm saying that to say, me personally, no. I would, God willing, every woman I deal with, I get them tested. But the ones who did have sickle cell, yes, they knew no kids.
So there's people out there that would know that their child was going to be having an inferior condition that they could possibly die from, and they would still proceed to want to have a child?
It's no different than having a genetic disorder like you have Down syndrome and pass on the genetic
material. You don't get that.
You don't. Sometimes you don't. Sometimes you do.
But
sometimes you may know it
know.
runs in the family. It's no different than having dwarfism. You know you have dwarfism, you're going to have a baby with another dwarf woman or man.
That's true.
So what's the difference? Why would you have a dwarf's child and have them go through the bone disorders and the breaking and the body braces and they're squished so their organs don't expand as much? There's always challenges to continuing your bloodline, but also there's a connectivity in relationship. If you're dating somebody and you're comfortable, they're comfortable, they know how to attend to each other's pain. They know what they experience in the darkness that happens when nobody else is around. It's a relatability. There's a gentleman that was at the conference who came from Canada. His girlfriend, they've been dating for almost 6, maybe 7 years now. The families were against it because of that same situation of them possibly having children. They have not had any children. However, they've had a tumult, a rocky relationship because of life challenges, but they're still together in spite of.
Because in 6, 7 years? You said?
Yes, and they support each other.
Some people,
What's the longest relationship you ever had with a woman?
Maybe about 4 years.
What about you, friends?
Maybe about 4 years.
What about you?
I'll give it a solid 3.
Dang.
What about you?
I'm trying to think. Because before I married my wife, it was about 3 years.
And how long you and the wife have been together?
6 years.
That's
No,
right.
6 years.
It's been a little while.
Yeah.
Yeah, it's been a little while. Yeah.
Keep
It
on
seems like that
pushing.
6, 7 is like the threshold.
Once you go over that, man, you're free.
You're in it for life.
But see, can I tell you? Can I say something? Can I say something? Really, real talk right now. Do you mind if I mention something that happened to you medically?
No, I don't care.
Okay. I remember you dealing with the acute chest syndrome.
When I was in a coma.
You was in a coma.
Oh, wow.
You remember that?
I remember that, yeah. And I remember your wife caring to you the way she did. She didn't let nobody touch you, clean you.
You came to see me in the hospital?
Yes, man.
I don't even remember. My sister said she
That's
came
a part
to
of
see
a
me.
coma.
And I didn't even know my sister came to see
You
me.
were in a coma.
You're in a coma, man.
I didn't know you came to see me. Okay, go ahead. I'm listening. This is crazy.
News
But
to you.
what I'm saying is, I don't know if you remember, I told you when you woke up, I said, Jake, she loves you. I don't know if you remember that.
I don't remember
I said, she loves you, marry her. That's what I told you. What I'm saying is, if she had sickle cell and she tended to you the way she did and you seen her heart, you telling me you still wouldn't have married her?
Well, to preface all of that, I had her get a test, a hemoglobin, how you pronounce it?
Hemoglobin electrophoresis.
Hemoglobin before. So my last 3 girlfriends before I married my wife, after I saw the relationship was going to possibly go somewhere, I said, hey, I had sickle cell. Because normally I don't say anything until like the 3rd or 4th date. I don't know about y'all. We'll talk about that in a minute. But so before you put all that effort into a relationship, you kind of want to know. Now, if you cool with having a child with sickle cell, that's a different story. But I didn't want to put a child through the pain that I went through and still go through now.
Correct.
So any woman that I was potentially serious about, I had them get a hemoglobin electrophoresis. So when it came back that she didn't, I'm like, okay, this relationship is full game, whatever. So we'll see what happens. But so that scenario you mentioned probably wouldn't have happened because I would have decided previously if I wanted to continue. But if I was in a relationship, she had sickle cell, I had sickle cell, and they by your side like my wife was during my coma, then that's a hard decision right there. It might even be worth sacrificing not having children to have a woman like that.
Because you have a rider.
Exactly.
You have somebody that's always going to be with you, no
the
matter
ride
good,
and die.
bad,
That's the
that's
ride and
sickness
die.
and in
It
health.
might be worth sacrificing not having children.
That's what I'm saying.
Because
And
you gotta ride or die.
And that's what I'm saying. That's how some people feel because they see that person, listen, you know how to take care of each other.
Correct.
You know what each other are going through. So
You speak the same
And let me
language.
tell you something. It's
But
not
to
like
find
that.
that is
hold
hard.
on. Hold on. No, it's not like
And
that.
people,
It's
period,
not like that
without
with
issues.
everybody. It's not like that with everybody.
Correct.
I had 2 sickle cell exes. One of them could care less
About you, yeah.
to come check on me. I will be there checking up on her, being there for her, and when it switched, man, please.
Well, when she was sick.
No, when she was sick, I was there.
You were
But
there.
it
when
wasn't
I was
every
sick,
birth.
She
It
just-
was
it was not
MIA.
reciprocated.
MIA.
So for her, oh no, no. But that first one, that girl was nowhere good for me. She was not good for me at all, but she was there for me, and that made me stay in there as long as I did because it didn't matter what was going on. It didn't matter what I went through. All I had to do was make a phone call, and she was gonna be right there. And even though I know she was not good for me,
She was good to you.
she was good to me. And that, to me, that was worth more than that. Because the relationship before that, a girl broke up with me because I had sickle cell.
Right.
Oh,
Been there.
absolutely.
Yeah,
I got
yeah.
broken up with in the hospital.
Same here.
What?
Same here.
Oh, yes,
Same
sir.
here.
In the hospitals.
On the phone. Because I had a crisis. This was my first independence, living on my own. I had my own apartment, had a boyfriend, had a job, living my best 20-something life, going out for the first time.
I mean, 30-something. When women say 20s, I mean,
What?
go ahead.
I don't know.
I digress. So I was living my Carrie Bradshaw life, and I got into crisis in my apartment, and he was there, and I said, call my mom. So we had this whole back and forth, and I'm like, you just don't understand. So my mom and dad came and took me to the hospital. I was in crisis. He tells me, I can't deal with this. Your mom won't let me be there for you. She said, no, blah. This is too much for me. We are no longer together.
Just over the phone.
And over the phone.
IV drip,
Same here.
crying.
Same here. Yep.
I can't believe this. And there was a few choice words with that, that went along with that
Of course.
situation.
Of
So
course.
you could, I hope you go on a rocket with gasoline draws.
Wow.
Have a nice day. But at the end of the day, that was a learning experience for me. It didn't harden my heart, but it made me see that not everybody is built to deal with somebody with a chronic illness.
Caretaker.
No, that's true.
Yeah.
That you
Caretaker.
have to have that spirit. And
Everybody
I
in the
also had
caretaker.
and went from bad to worse. I had another one that would only show up like after visiting hours. And I'm like, what do you mean? I'm trying to get rest and I'm in the middle of getting pain and you showing up at 1 o'clock? What the, what is this? Why aren't you here during the daytime when my family is here?
Booty call hour.
No, not at all. But
Oh, I was the only one that did that in hospital.
I think, yes, that was, you were a derelict.
So when y'all go to the hospital, I haven't had to get admitted in over 2-3 years, but I did go to the ER maybe 4 to 6 months ago because my back was just bothering me way too much. I couldn't take it. How do you all feel the treatment is when we go to the hospital from the ER perspective and if you have to get admitted? So as far as how we get treated initially, they normally think that we're there to get some drugs or some pain medication.
Which is ridiculous.
Which is the normal first thought. It's not until after they get to know you, then they say, okay, well, he can handle, more milligrams. 2 milligrams of Dilaudid is nothing for him. I had, 4 milligrams one day, and I walked past the nurse's thing. She was like, I just gave him 4 milligrams of Dilaudid, and he walking around talking to everybody like it was nothing.
What drug addict do you want to know that does paperwork to get drugs? Because you got to fill out too much information to go through the ER to be on. I mean, sometimes you do have people that hop from hospital to hospital, but
Right.
it's too much. Why I got to sign too many documents just for a little bit of drugs? That's crazy.
Special thanks to Butler Capital. If you're not beating the bank's interest rate, check out butlercapital.info. Also, Rich Kid Camp Online if you want your kids to learn about financial literacy and investing. Rich Kid Camp Online is a tremendous program to get them started in financial literacy. And last but not least, Money University. If you're a student that wants to learn about how to start investing in real estate and you don't know where to start, check out moneyuniversityonline.com.
For them to have that association with us, you know. But there are frequent flyers, unfortunately, in any situation. If you hook, you hook.
Frequent flyers.
Yeah. That's a term they use,
That's
man.
what they
That's
call
what
it.
they call us.
They call it frequent flyers?
Yeah,
Seriously.
frequent flyers. Yeah, man.
That's what they call it.
Because you go from hospital and then you get redlined.
Yeah.
Your name gets flagged in the
When last
system.
time you been admitted?
Thank God, it has been last July, but I've had aches and pains.
Josiah, when last time you been admitted?
I was admitted in 2020 for COVID because Dr. Blyden didn't know how it was going to affect me. But outside of that, for sickle cell, 2017.
Yeah. I've
Right.
been maybe about 7 years now, about 6 years.
When last time you been in ER?
Yeah, I went to the about 3 years ago.
The ER this month. What was that? Yeah, this month I went. The beginning of this month.
Last time I was admitted, but I also have gone for infusions to kind of stay out of the hospital, where you get you get fluids and pain medicine to kind of offset anything that may occur.
What about the pain clinic? When last time you went to the pain clinic?
Earlier this year, but I go to Baptist, so
Josiah.
Last week, you go to Baptist as well.
Baptist.
Oh
Kendall.
no.
Not- I don't go to-
Yeah.
You go to the pain clinic, French? Oh, okay.
Well, I shouldn't say I've been there, but it hasn't been recent times, you know.
But let me answer your question because
Yeah.
none of us has answered your question. We kind of went somewhere else. To answer your question as far as how the treatment is, ER and being admitted, I haven't been, like I said, I really haven't been admitted since 2017. I will say my 2020 visit, I was there for COVID. And unfortunately, and I know we all go through this, you know, where you have been admitted for something unrelated to sickle cell. But they're going to always focus on the sickle cell. And so, yes, my admission initially in the 2020 for COVID was not good. And I kind of had to let them know who I am because I haven't been there so long. But when I was going there, you know, I was put on the VIP list because I had complained so much on stuff that they were messing up on that they was like, okay, make sure Mr. Frierson has everything he needs. So I kind of had to call them administrators and say, hey, I know it's been a while, but I'm here. Y'all need to get this in order.
Tighten up.
But emergency room, like that was my first time going to the emergency room in years in this month. And I honestly had a good visit. And that visit that was at Memorial Regional, that visit was due to the work that ASAP does, Advancing Sickle Cell Advocacy Project. That was because of the fight that they do to get, a sickle cell home and get the doctors to treat you right. But before that, we all know that we can go in the ER and we can get treated like dirt. I have seen people who've never taken pain medication go and say, I'm hurting, and the doctor say, we're going to give you 3 milligrams or whatever. And I'm saying, I have sickle cell. I've taken this all my life, and they give me 0.5.
0.5.
0.5.
That's for Dilaudid.
That's an ad.
Yes.
Absolutely. So
Because they don't want you to get high. And then the nurse come and dilute it.
with more saline.
Dilute 0.5.
Dilute
Yes.
0.5.
Put
I'm
more
like,
saline and
you're
stuff
not
on
getting high on me. Lady, I ain't finna feel this.
I could have gone and stayed at home for this Tic Tac, you know.
I got medicine stronger than this
at the
home.
house, you know, if you really want to talk about
Do
it.
you all see a difference between the new doctors and the old doctors?
Oh, totally.
Yeah.
Okay, I see.
Yeah.
And as far as I get treated going to the ER, I've had some battles, but I haven't had to fight them alone, thank God, because I have two amazing parents that are advocates
She
for
does.
me.
She does.
I am super...
You live by yourself, or you live?
No, I live with my parents.
Okay.
I'm very blessed. I have an active mother and father in my life, and they go to war. So that's why I have a warrior spirit as well. And I've had to push back on doctors and say, no, this isn't going to work. Oh, well, we're not comfortable. I don't care what you're comfortable with. I'm the one in pain. Make me comfortable. You know? Oh, I don't think that you should have, maybe let's try 6 milligrams of morphine. Ma'am, do you really think now mind you, we have all been on medication since we were children.
Right.
What makes you think my tolerance level is the same as yours, who's
Bingo.
not had an issue with pain their entire life? I started out as a child taking Demerol. That's something you give to people who are you know. So if I'm taking Demerol at 10, do you really think 4 milligrams of morphine is going to do anything for me, ma'am? You know,
So they
I've
should look
driven
at our
myself
history.
home from
They don't look
clinic.
at our history when we come in. They think we just got sickle cell yesterday.
Listen, they're going to look
just
at
say-
Maya and say, she's small, she
Right.
can't handle this. He's big, he's a
That's
little bit
true.
bigger.
Correct.
We
That's
probably
true.
can get that.
That's true.
Let me tell you something, I done seen people smaller than her take bigger dosages
Right.
than
Then
I
me.
do.
Yeah,
Correct.
me too.
Yeah.
Me too.
And walk away
It's
and
about
have a
tolerance.
conversation.
Yeah, it's about the tolerance of the person because, like she just said, we've been taking this from a child, but they don't think about that. That's why me, when I advocate, Maya will tell you, I always bring up tolerance because they substitute tolerance for addiction.
Correct.
Tolerance is not addiction.
At all. And that is a very misnomer across the industry. And they're, my license, my life. Well, my life. Do I really care about your license when my life is on the line? You know, and you want to nickel and dime me on this pain medication? I get my pain under control first, and then we can have a step down conversation. But I need this bolus, and it's not even stopping this pain. It's just making it tolerable, you know, at this level that you think is so excessive. But that's why you need a pain management doctor, because I immediately tell them, hey, my pain management doctor, my dad keeps the card in his wallet of the woman that is the pain management doctor when I get admitted on the floor. Call her. She's familiar with Maya. Call her hematologist. You know, primary, not so much because they've taken that responsibility away from your primary physician. They've put it all on the specialist now. But we have, and it's the same information that comes up in the computer every time we get admitted with our name and social.
Yep.
So why are you acting like this is my first rodeo? Clearly it's yours. I've been sick longer than you've been practicing. What's good?
So, would you take the cure? Do y'all know about the cure and what's involved in it?
Okay. So with that situation, it's a slippery slope. They tell you all of the bells and the whistles and the good things, but they don't tell you what the downside is, which could possibly be, if you're a male or a female still of childbearing age, sterility. They don't tell you about that. They don't tell you about the brain fog. They don't tell you about the fact that it's not an instantaneous cure, and you could possibly, because they take your immune system down to almost zero.
Yeah, 2%, 1%.
You have mouth sores and things like that, which come along with the chemo, which is the radiation in your body, and how you can or cannot always bounce back from that, depending on how strong you are going in.
Right.
So I need you not to just tell me the glitz and the glamour. I need you to tell me the dark side too. What do I expect? And probably they do that on the one-on-one consultations.
Right.
But when they advertise these cures or treatment, or whatever you want to call it, bone marrow transplants. All of it comes with
Stem cell.
all of it comes with risk.
Yeah.
So
And
would you do it?
Not until you give me a reason why me continuing to kick ass and take names right now is going to be better than me kicking ass and taking names without
We
it.
need to find out we can cuss. I don't know.
I'm sorry.
No, that's fine.
I apologize.
Josiah, would you do it?
Kick butt.
Now, not to say, we don't know. Honestly, right now, no.
Okay.
Correct.
And my issue is, well, number one, first and foremost, I don't have $2.2 million.
Well, it's not that anymore.
Just want to let y'all know
It's
that.
not anymore.
Bluebird, I don't have it. But anywho, but whether it is that or not, the thing is, to be honest with you, we know that they have put stuff out there that they've had to recall.
Correct. Recently.
So
I never thought about that.
And this was stuff that I have taken. And a lot of these things, to be honest with you, that they get fast tracked. They don't do the normal procedure during the FDA like they do. It's like everyone's at a point now, we want to put
Money
something
grab.
out. We want to put something out for sickle cell to get some money. So, we're going to do this, we're going to do that. And the thing is, I'm just keeping it real with you. I have seen stuff be put out. We have all seen stuff be put out for it to be taken away, or stuff be put out, and then you hear, like she just said, the bad effects later on. So I do know one of the studies, if I remember correctly, 8 people they cured, I think, with the NIH. No, it might have been up over in France, one of them, but all 8 of them wound up getting cancer.
Really?
Yes.
But what did they go? What procedure did they go in for?
I don't remember. I don't remember. I don't want to lie to you and say, but I know all of them wound up coming with cancer. I ain't trading cancer for sickle cell.
Thank you.
I'm just, I know how to deal with this. I'm gonna have to learn that all over.
That's a different beast.
Yeah.
The different
So-
set of rules and everything, man.
Exactly.
Better
So
evil
it's
you know
just,
than
it's
you
But
just.
I think, well, some
Right
cancer
now,
that's
I just
permanent,
wouldn't.
but some that's temporary too. What type of cancer did they get?
That I don't know.
Oh,
I have to look more into it and get back to you. I don't want to lie to you,
But
but
that
I
was an
do
effect.
remember. Yeah, that was an effect.
Traded one for one
Another.
problem for
Yeah.
a worse problem.
And then something else I will say, one of the first cures that they did with the NIH, if y'all remember the one that was on 60 Minutes, I believe it was.
With the young lady.
With a young lady, they gave you a week in order to give you the virus to change your DNA, your gene. They had to put in you a weakened HIV strain.
Yes. And that was with
Weakened.
CRISPR, a weakened HIV strain.
Weakened meaning it's still a possibility
That
that
you
you can get
HIV.
HIV.
Yeah, that's true.
No one did, but it's still a possibility.
And you're infecting yourself.
Let me tell you something.
Wait.
That was on
Where
60
was
Minutes.
this?
That aired on 60
That was
Minutes.
the one on 60 Minutes.
With a young lady.
Yes.
It was a black
Young
young
black
lady.
lady, yeah.
And she was in the Northeast. And she had a short haircut because all her hair fell out. But anyway, they infected her with a low strain of viral strain of HIV.
And what's the purpose of that?
It was for CRISPR to change her genetic molecular structure to circumvent the sickle cell genetic problem.
Yeah, take away the abnormal gene. The doctor said that the HIV strand is good with inserting viruses. So they discovered
Or
that
so they say.
that strand was the best one to be able to put the virus in there to turn that abnormal gene, that sickle cell trait, turn it to normal. So with that,
Close to normal as possible.
close to normal as possible.
According
So
to them.
according to them. So yes, they did cure them.
But they gave them something secretly. Was not secretly underlined.
No. They did not give them anything. All of them
That's
tested.
an HIV virus.
All of them tested negative though. They knew what they were getting.
Okay.
You heard about this
Everyone
from-
tested
Yes,
negative.
this made national news.
Yeah,
It was on 60
it's on
Minutes.
60 Minutes.
How long ago?
No one got
About
HIV.
4 to 5 years ago.
No
Oh,
one
really?
got HIV. They weakened the thing. All of them came back negative for HIV. But I'm just saying, I'm not willing to take that risk because the doctor said himself, it's still a chance that you can get it. When you can make that a 0% chance, come holler at me.
That's never.
And
gonna
what
happen.
other disorders are they using
Well, then I'm
HIV
never gonna do
for? Why is it us? Why is it us? Because
mean black folk?
Yes, because we don't talk about systemic racism that has occurred from slavery until now, which is if we have the oldest genetic blood disorder in this country, there should have been way more strides and efforts. And before AIDS took place as a global crisis, there were more strides and efforts being made within sickle cell disease. The money and the research was there. Mr. French can attest to this as part of SCDAA. And once the AIDS crisis took a global perspective, they withdrew all of the funding for sickle
Yep,
cell
correct.
and put it towards HIV and AIDS
We got pushed on the rug.
because it was no longer about curing a genetic disorder. You had people who were non-melanated being affected
Bingo.
because of drug use and promiscuous lifestyle, and it reached the burbs, and so many white Anglo-Saxon males in the gay community were being impacted by this, and because it was white males, whether their affiliation sexually made any difference didn't matter because they were already seen as subpar. But it was the fact that there were white men being wiped out, and they had to get a wrangle on that because
Really?
that's who runs this country. So it's deeper than rap. You have to go back to several layers of systemic genetic racism. Henrietta Lacks, learning about the women that were practiced on in slavery for gynecology with no anesthesia, Tuskegee.
The syphilis thing
You can
program that
you
they
can
did.
go down the
Yeah.
rabbit hole and
With
reach
all
a
the
whole
black
different.
people, yeah.
So this is how we get to now HIV strain, low-level possibility. Nobody had it. Fingers crossed, thank God. However, this is how we get that. Oh, we'll give them this as a combatant. Are they doing this for lupus? Are they doing this for the March of Dimes people? Are they doing this for any other disorder? Using a strain of HIV? Question.
So, French, where do you see sickle cell in the next 5 years to wrap this up?
Okay, I think that compared to 10 years ago, it's looking a lot more positive. Why? We have more research, and especially researchers coming from overseas. Researchers who come to this country as students, whatever, and now they are more involved in all out research to find a cure for this terrible disease. And also with that comes education. Education, the fact that what you and I know now, the people, our generation before us, who were living with sickle cell disease, they didn't know it. And also with that now, our lifespan pretty much increased a lot, increased a lot. Because I told the guys earlier, my brother died at 10, and his 10th birthday, 45 years ago tomorrow. But in the same breath, when the people in around with sickle cell, by 21, 18, 19, less than 25, they were all gone, and most of them were gone. And those who were alive, they were, I would say, merely existing as opposed to living, in the sense that, their quality of life was way down there, man. Quality of life. And also with that came, again, education. It's got to be with education. Everything goes back to education. Or willing am I to learn something, or willing am I to read, and to not just keep it to myself when I've read it and I've learned it, but to share with others around me, including people in the medical community, because, we live with this. So we are the people, we are the practical people. We are it. The other people, sorry, they're just from a theoretical point of view. They have never been in a crisis. They don't know what it is to, all of this stuff, and, the IV and everything, trying to breathe, and machine is breathing for you and all, every so often during the course of the day, you have to be taking high doses of medication. Some of these guys, just the name, send them running. But we have to take this, the first wave. And also our dietary practices too. See, you and I, we have things we don't eat. People say, hey, you just, wait, what's what you doing? No, because I've got to watch my health. When I'm in the hospital, when I'm in crisis, I'm the only one there. I've got to live with this on my own. So, try to get my lifestyle.
That's a wrap. Welcome to the Patient in Progress Show. See you on the next episode.
Yeah, check it. Hey, Mr. Sickle Cell, I can see that pain is hell. The way your cells turn to sickles like a witch cast a spell. Hey, Mr. Sickle Cell, I'm hoping that all is well. It's a superpower how your hands really start to swell. You could just punch away your demons, send them screaming into hell. You in pain and the people around you really can't compel. Hey, Mr. Sickle Cell, what? Check it. Hey, Mr. Sickle Cell, yeah, check it. Whoa, wake up in the morning in pain. Clinic never really opening.